Hello, welcome to another episode of Boomer Health at Home, the show where we provide you useful information to help you and your family live a happy, healthy life. I'm your host, Brett Pulte, and this is the time of the year when different illnesses start to creep into us, and everyone's getting sick and staying home from work and all the unpleasant stuff. So today we have registered nurse Jennifer Hicks with us.
Good morning.
And Jennifer is going to help us demystify the various vaccinations that are available for us this time of the year. So thank you for being here with us today.
Thank you for having me.
So can you give our viewers, just a brief overview of your credentials and experiences?
Sure. So I'm a registered nurse. I've worked in the emergency department and also in the surgery centers, operating rooms, William Beaumont Hospital. And now I work in home care. Have worked in home care for the last 6 years.
Oh, good. So you've seen a little bit of everything.
I have. I most certainly have.
Good. So our topic today is adult vaccinations, and a lot of the advantages to vaccinations are somewhat evident, but what are some of the side effects that people can experience from the vaccinations?
So generally they're very, very minor. So it's usually pain at the injection site.
Okay.
That's the most common.
Yeah.
And one great thing to do is to massage it, rub it, and move the area where you had the shot so that you can disperse the medication.
Okay.
The other is sometimes you may have symptoms of something like a flu. Mm-hmm. So just feeling tired, body aches, but that generally passes within 2 days.
Okay.
Yes.
So now, how are vaccines generally made?
They are not live viruses,
Okay.
so oftentimes there is confusion. Now, but the aerosol flu vaccine is a live virus,
Okay.
but they take out part of the DNA so that it isn't truly the true virus.
So it's getting in you, but it's not affecting you.
It does the way that what it's doing is having your body react to the virus,
Okay.
but it's not giving you the virus. So it's building up your immunity to it, antibodies
Gotcha.
in your body, but it's not actually giving you the virus.
Gotcha. So it's kind of telling your body, this is what it looks like if it comes in. Help me.
Right.
Okay. That's,
Right. Exactly.
Yeah.
That's right. Yes.
that's always interesting to kind of put that weird little spin to it.
Yes.
Yeah.
Yes.
So what are the risks for elder adults if they decline their annual vaccinations?
So their risk is they are generally more susceptible then to getting the flu or pneumonia or shingles. Then also it can actually debilitate them more. So even if you do get the flu vaccination, which they are the Center of Disease Control, they're picking the top 3, you still may get the flu, but you won't get it as severe. So people who choose not to get the vaccination, if they do, they're at a greater risk of getting the flu or pneumonia or shingles, and then it may develop into something more serious, or even the pneumonia vaccine, if I didn't mention that.
Yep, and that's what you hear people say, I got the shot and I still got sick. What's the point of having it?
Right.
But like you said, it lessens the severity.
It lessens the severity unless it's a different type of flu, but that's quite rare.
Yeah.
And then the duration of it.
Oh, good.
So, right.
Good. So for adults 50 and older, the CDC recommends 4 vaccinations per year.
Right.
And that's the influenza, shingles, and pneumonia, like you had mentioned. But there's also a Tdap vaccination. What does the Tdap vaccinate against?
So that's tetanus, diphtheria, and I'm going to say the whooping cough. It's pertussis.
Yes.
And yes, so that it helps you to not be susceptible to those.
Okay.
So they combine those 3 because they could, and then you're dealing with all 3 of those at the same time.
Yeah.
So tetanus is, once again, we all knew that as a child. I don't know if you did, but if you step on
The rusty nail. Yep.
because of the soil, you can get tetanus, which is going to give you something like lockjaw or rigid muscles.
Yeah.
And then the diphtheria is very contagious, so that would be dealt with antibiotics or antiviral, and you can actually have to be put into confinement with diphtheria. And then the whooping cough is generally much more severe for children.
Yeah.
So it helps. Now you're okay. Go ahead.
Yeah.
Yeah. So I was going to get ahead of myself. Go
No,
ahead.
that's fine. So those are all terrible illnesses that we've been discussing. And if a person were to contract one of these, what are they looking at for treatment?
So generally, the great thing is we do have antivirals.
Mm-hmm.
So if it is caused by a virus, we also have antibiotics. So basically, that's what's going to happen, and rest.
Okay.
Yes.
That's that's good to hear that we have the ability to combat things now.
Yes, we do.
Yeah.
Yes, we do.
So, the vaccine for pneumonia seems to be a pretty important one, and I know personally I've had family members that have contracted pneumonia, and it's not a fun time for anyone.
Right.
What happens to a person's body when they get the pneumonia infection?
That's a great question. So, we know that it affects the respiratory. Pneumonia is respiratory.
Mm-hmm.
So then they have difficulty breathing. They can also start coughing up phlegm, pus.
Yeah.
It becomes very debilitating.
Yeah.
Great weakness. So the body aches, those things, the headaches,
Mm-hmm.
the fever, that's your body fighting off the illness.
Okay.
And so when you also get the swollen glands, that's the body, your white blood cells, trying to combat the pneumonia. So our body works on it, but it does create pain in our body while our body's doing that.
So you're saying the more you hurt, the more it helps.
Right. Well, the more you hurt, the more your body's working. Right.
Yeah.
And then you definitely want drugs. So you do want antibiotics, antiviral, and then pain medication to help with the pain.
Okay. So now we all know pneumonia can be pretty serious, and it can even lead to death in some cases.
Yes.
How does the infection get so far that someone does die from it?
So it depends. So much of it depends on the individual and their immune system.
Okay.
So that is one of the reasons why the CDC recommends that people 65 and older, or young, or people who are ill, do get the pneumonia vaccination.
Yeah.
Because you can, all of a sudden, your body just cannot fight against the pneumonia. It will then has a potential to travel through the body, get into the blood, and then it becomes a systemic infection, and your organs begin to shut down.
Wow.
A lot of times, though, it can be respiratory, and then that can lead to something like an acidosis in the body, and then the organs get to shut down. So it can get out of hand really quickly.
It's pretty serious.
It has a potential. Yes, it is actually. It still is, even today.
Of course, yeah. And shingles is also fairly serious and has some very unpleasant symptoms.
It does.
What should someone look for if they think they're beginning to have signs of shingles?
So oftentimes it's a pain, and it's a nerve pain, and there's kind of a pathway. You feel a pathway.
Okay.
There's a rash, there's blisters, but I have to say the number one symptom is pain. And it's an unusual pain, and it makes you feel, it hurts. There is no question. You think, oh my God, I'm dying, right? But you're not. It's the nerve pain.
Okay. That's so. What would be the treatment for shingles if someone did contract it?
Antiviral medication.
Okay.
And then the other is pain medication to help with the nerve pain, because it's very, very painful. Yes, and if you have blisters, you're very contagious. So you would stay home from work. You would definitely not go around people.
Yeah, just try and isolate yourself.
You isolate yourself, most definitely.
Yeah, and I'm sure a lot of our viewers have unfortunately experienced nerve pain in backs, hips, shoulders, and everyone knows it's pretty unpleasant.
It is. And the thing about shingles is it feels like you're on fire. It feels like it's on fire.
Yeah.
And your clothes hurt. A strong wind hurts. So depending on where it breaks out in your body, it really can debilitate you, actually.
That does not sound fun, and I hope no one ever gets that.
I know.
So, we all know the symptoms for influenza, but, what does that virus actually do once it's in your body? What does it do to you?
Okay, so, the virus will come, I guess, what it wants to do is make your body the host.
Okay.
So it wants to reproduce itself in your body. Then your body wants to fight it off. So then there becomes a war in your body. So influenza, once again, it's respiratory. So it will affect your ability to breathe, and you're going to create mucus. It can create pus, so your body's fighting it off, so then you create debris inside the body, which then creates the pus, but then the virus multiplies in your body, and then what's happening is there's a huge war. So who's going to win? Who's going to win inside the body? So you cough. A cough is to try to get up the mucus. So your body's trying to defend itself. The fever, the body aches, it's all with the body trying to defend itself against the influenza or the flu. So it's pretty much an all-out war.
Yeah. That's a great way to put it too. I never actually thought of it that way. It's mostly a fight.
It is, right.
You get the fight or flight mechanism, and let's hope the fight wins.
Exactly, right, yes.
So, as our viewers know, I've mentioned it a few times over the past few months, I have my first child on the way.
Yes, congratulations.
Thank you. So, a lot of people want to know, what should, this is my parents' first time being grandparents too.
Okay.
What vaccinations should they get? What should I get? What should we really all be looking for to protect ourselves against, my son coming into the world?
Okay, so, and I know what you're saying is, so your son can be protected when he comes into this world, right? And we don't contaminate him. Right. So, are your parents 65?
They're late 50s, early 60s.
Okay, so great. So generally, I will say for people who are 65 and older, what's recommended by the CDC is the flu vaccination that is a plus. So it has 4 times the amount of antigens. Your parents aren't in that, but so that wouldn't be for them, but it would be that they get the flu vaccine, that you get the flu vaccine. Because your wife is pregnant, it's best actually that you don't get the aerosol, because that does have a live...
The active portions, like you said.
Correct, right.
Okay.
So you would get the shot as opposed to that. Even though you technically could, but I wouldn't even risk it. That would be me. Okay, I'm conservative that way. I'm sorry, your parents are in their 50s.
Late 50s, early 60s. Yep.
Late 50s, early 60s.
Yep.
So then once into the 60s, it would be the shingles vaccination. After 60 and older, and that's one, and then there's a second one in a year. So that, your wife would be good that she gets the DTaP, the DTaP. And then she can do that while she's pregnant, as well as the flu vaccination. But I am going to I do need to state, it's best that she always speaks to her doctor.
Yes.
Because they know her. So I'm saying what's recommended by the CDC.
Of course.
And for you, it would be the flu vaccination. And then to make sure you wash your hands. Wash your hands.
Be clean.
Yes, and not obsessively clean, not antibacterial, everything clean. Because what really, really helps is just soap and water and friction. Soap and water and friction, keeping areas clean. Not all the antibacterial wipes and things like that.
And it's funny you mentioned, talk with our doctor, and our doctor is, a bit like you. He is into the osteopathic treatments. So, that's not something I've looked into. It's not something I'm into, but it's something my wife is into as well. So that's kind of been a weird transition for me, hearing, the doctor say different things, and I'm thinking, isn't there a medication for that, or, things like that. It's interesting.
It is interesting. And so we can do things so the vaccines is by the CDC, these are things that they recommend. It's also eating well. A lot of essential oils people use to clean with. For your wife, prenatal vitamins, obviously, making her environment a healthy environment for the baby to grow. And then for you, because you're going to be dealing with not a lot of sleep, it's also for you to have a lot of nutrients and things that make you feel good. Right?
So, we've been talking about vaccinations, and where can someone go to get these vaccinations done? So,
your primary care physician, there are flu clinics, the pharmacies. I think they also have them at probably urgent care centers. Yes.
Good. So, with everything we talked about today, what is your best advice for staying healthy this upcoming flu season?
Flu season. So I will say the CDC says the flu vaccinations, to make sure that you do get those. Hand washing is something that everyone can do, and that's proper hand washing with soap and friction.
Yep.
For ABC, happy birthday a couple times.
Yeah.
Always go longer than short. And eating well, rest, and doing something that you love.
Okay, that's good to, especially during these winter months, you hear the seasonal depression.
Yes.
Doing something you love is a way to combat that.
Yes, it is.
That's great to hear. Thankfully my son's going to be here middle of winter. He'll be here late December, so we're going to have something to be happy for.
Right. You'll have something to celebrate.
Exactly.
Right. Yes.
Yeah.
New life.
Jennifer, thank you again for joining us today. You gave us a lot of great information, and I'm sure this is going to help a lot of our viewers throughout this entire season. And if you at home have any questions about today's topic or anything else you want to see on the show, drop us a line at boomerhealth@americaremedical.com, or you can call us at 248-288-2270. Thanks for watching.